and good afternoon to our colleagues here in the media. And thank you as always for being here to help educate our public this time about monkeypox. As you know, Monroe County detected its first case of monkeypox late yesterday. We have a handful of other cases that we are suspecting but are not yet currently confirmed. Due to patient confidentiality, we are unable to share specific details about the known patient, but I can tell you that he is an adult who has been instructed to isolate, and we will continue to monitor him throughout the course of his illness. I think the most important thing to remember here is that this is not a cause for alarm. This is not another COVID-19 pandemic. Monkeypox is not a novel virus, and so we know a lot more about this than we did about COVID. And there is already an FDA-approved vaccine for monkeypox. The current strain of monkeypox we are seeing is rarely fatal. And currently, the risk of contracting the virus is extremely low for the vast majority of the public. That said, monkeypox symptoms can be very painful and even cause permanent scarring. So even though I do not want anyone to be overly alarmed, I think we should all remain informed and aware of how this progresses both locally and beyond. So even though we are not dealing with a clinically severe or fatal illness, the best time to limit transmission and potentially any other disruptions to our daily lives is right now. So first, know the symptoms. People with monkeypox infection usually have rashes, bumps or blisters on the genitals or other areas such as the face, the hands, or the feet. Some people can also experience flu-like symptoms like headaches or body aches, which may develop even before the rash appears. Second, learn about how it is spread. Currently, we believe monkeypox is spread through direct contact with infected sores or rashes when there is skin-to-skin contact. Like other viruses of this type, it can be spread through contact with objects or fabrics that have been used by somebody who has monkeypox. We believe that people who are contagious are people who are showing symptoms. Spread before symptoms begin is believed to be very rare since it's through direct contact with open sores where we believe transmission is most likely to occur. The role of respiratory or airborne spread is being investigated closely. But historically, for viruses of this type, the risk of spread is most concerning when there is very close or prolonged, especially skin-to-skin contact. Third, know about your risk for contracting the virus or for experiencing severe symptoms. Because of social networks and the patterns of exposure in the current outbreak, this disease is currently disproportionately affecting men who have sex with other men. So at this point in time, we consider that population to be at higher risk of getting monkeypox. That said, it's important to realize that anyone who is susceptible can contract this illness. So older adults, pregnant women, immunocompromised individuals, and young children should know that they may be prone to more severe symptoms if they contract monkeypox. Finally, we urge anyone who falls into these higher risk categories to take precautions. Talk about this with your sexual partners and other close contacts, and avoid skin-to-skin contact with anyone who has a rash or other symptoms concerning for monkeypox. And as usual, if you feel sick, please stay home and contact your healthcare provider. The symptoms of monkeypox resemble the symptoms of many other conditions. And as is the case for most of our community, we should all take a few moments to learn about monkeypox, to be aware of the facts, and to avoid misinformation. While we will continue to learn more about monkeypox in the coming days and weeks, there's already much more that is known now compared to the early days of COVID. As usual, we will do contact tracing to try to interrupt transmission of monkeypox in our community and in beyond. But the most important way we can keep one another safe is for people who believe they might have been exposed to be responsible and take the steps I mentioned above. Again, we are not in a crisis. We are simply asking everyone to stay informed, to know your risk, and if necessary, to take precautions. Our website, monroecounty.gov/health, contains a number of links with useful information that we hope you will take advantage of. And with that, I will turn it back over to Julie, and I welcome your questions. Thanks.
Thanks, Dr. Mendoza. First up is Spectrum, if there is. I'm not sure if there's a reporter on or not. Spectrum, do you have a question? I'm going to take that as a no. We'll come back to you if you do have one. Natalie Kuchko from WROC.
Good afternoon, everybody. So Dr. Mendoza, just a few days ago, you had said that the time is coming, or it's to be expected, the first case of monkeypox, as we've seen this spread throughout New York State. I want to ask specifically on the vaccine, what your thoughts are. We know that availability is fairly low. So do you see in the future maybe a significant demand of this vaccine in the days and weeks to come?
I anticipate the demand to increase. Certainly, we expect that as more people become exposed to monkeypox, we will see more people who are eligible for receiving the vaccine. Currently, we're following the New York State Department of Health's guidelines for how we get the vaccine. That's who we will need to get the vaccine from, who in turn gets the vaccine supply from the federal government. So currently, the supply of vaccine is somewhat limited. I know that a number of pharmaceutical companies are in the process of producing much more vaccine. So I think in the coming weeks and months, we'll see much more capacity to vaccinate the public.
Do you have a follow-up question, Natalie?
I don't. Thank you.
Okay, then we're going to go on to Jennifer Lukey from WHEC.
Hi, good afternoon. I wanted to ask a couple of quick things. So you said there's a handful of suspected other cases. Without obviously divulging any identifying information, are these folks connected in some way, or do you believe the transmission into the community came from different sources?
Based on what we're learning so far with our tracing, I do not believe that these are related cases. So if it turns out that these cases are in fact confirmed, then this would mean that we have community spread here in Monroe County.
And speaking of that, I guess, at what point are people most contagious, and does it have to be skin to skin? I know you talked a little bit about this as far as you could touch something that someone touched, but it has to be sort of prolonged, right? So at which point are people most contagious, and what can you do if you think, is it sort of like COVID where you just stay away from the person, or is it just that you have to not have the skin to skin?
So it's different from COVID in that way. We believe the skin-to-skin contact with an open rash or sore is the most risky type of mode of transmission. We also believe, unlike COVID, that there is a very rare pre-symptomatic or asymptomatic spread. So people who are not experiencing any of the symptoms, be it the rash or the fever or chills, we believe are not contagious very much at all. So for the vast majority of people who are not experiencing any symptoms, the current assumption is that there's no reason to worry. As far as how long the contagiousness period lasts, it really depends on how long that rash lasts. So in that way, it's not unlike shingles or chickenpox or other viral illnesses that cause the open sores or vesicles. As long as you have the open sores or rashes on your skin, we believe that is when you're the most contagious. And it's not until that rash heals over and there's skin that's replaced the rash that we believe that infectious period to have discontinued. So the duration of isolation, unlike in COVID, for monkeypox really depends on that individual's healing process.
Thank you, Jennifer. Dalton Williams from 13 WAM.
Hi, so my first question is, how long does it take for these symptoms to appear, like the fever or the rash? How long does that take to show up in an individual?
So unlike COVID, it can take much longer. So we believe around 2 weeks, up to 2 weeks after exposure, you can come down with illness. So that is a difference between monkeypox and coronavirus. It's one that we want people to be aware of. Any exposure that you might have had in the last 2 weeks with a person who has monkeypox may mean that you can contract it from that individual.
And while we're doing contact tracing for the individual who presented positive here in Monroe County, with summer in full swing and a lot of big events coming up, are we concerned that we're going to see more and more cases? I know we touched on it earlier, but just is there any concern with how late these symptoms present themselves?
Well, in some sense, it's reassuring because we know that people who don't have symptoms are much less likely to transmit the illness. So in that way, it's somewhat reassuring. That being said, it being summertime, we know that there are festivals and parades and just in general, a lot more people gathering. There is more of that concern. This is a social illness, if you will. It's something that's passed from person to person. That being said, there are precautions that you can take. Even if you're at a dance club or at a parade outside, Minimizing your skin-to-skin contact with people in general is reasonable and certainly very prudent for anybody who has a rash or symptoms. If you yourself have any of those symptoms, be it a rash or the flu-like symptoms, we advise that you stay home. Try to keep your circle safe, stay away from clubs and parties and parades and festivals and the like. And in that way, we can interrupt the spread of monkeypox here in Monroe County.
Thank you. Sean Lehman from the Democrat and Chronicle.
Yes, thank you, Dr. Mendoza. For people who are concerned that they may have been exposed, what should they do?
Well, in that case, we would ask you to call your healthcare provider. At this point, unless you know that you have been exposed to somebody who is positive, we want you to monitor your symptoms, but call your healthcare provider because, like I said earlier, if you have symptoms, it may not necessarily be monkeypox. In fact, it's much more likely to be something else at this point. But if you think you've been exposed, talk to your healthcare provider about it. If we determine, or if your healthcare provider in conjunction with our office determines that you were exposed to somebody with a confirmed case of monkeypox, then we would entertain vaccination.
Okay, thank you.
Mm-hmm.
Okay, final question is from Raquel Stephen from WXXI.
Hi, Dr. Mendoza. Nice seeing you.
Likewise.
Once again. I guess all the good questions have been asked, but this one patient that the case was confirmed, do we know if he got it out of town? I know there's was he traveling when he got this? Can you explain more on how this person got this?
Right. I can tell you that travel was involved. There's really no way to know if this person was the first person, if you will. But given what we're seeing both here as well as across the state, travel was involved in this individual's case. But I think there's good reason to believe that we have community transmission because I don't think the other cases are likely to be related to this first individual.
And I know, telling people to avoid going out or going to clubs is going to be kind of hard. Is there any other measures that we could practice if we're out to avoid?
I mean, I wouldn't advise against going to parades, festivals, or clubs. I think if you're sick or having symptoms, then yes. But if you're feeling well, if you don't believe you're at risk, or certainly if you don't think you've been exposed to anybody, it's very reasonable to socialize, go out in public, do the things we normally do. It's when you feel that you might be at higher risk that we want you to pause and think twice. Again, anybody who's had symptoms, fever, the rash, most concerning symptoms, we want them to stay home. But for the vast majority of people who aren't experiencing any of these, there's no reason to curtail our usual summertime social activities here in Rochester.
Okay, that does it with questions. Thank you, Dr. Mendoza, and thanks everybody. Great to see you.